Another question we get is this. Will NPI help me with tracking of the calls, the results tracking, and also call management? What's that about?
If you look at what we do, we work in all promotion mediums that make sense, that makes that work, or have at least a statistical chance greater than zero of working. Okay. And if you look at that times hundreds of clients, you end up with literally, thousands of phone calls. Okay. And that data comes in centrally. It's aggregated, and we can see it. And
we can listen to it.
We can listen to it. And with that data, we can also see and quantify where the clients themselves are missing opportunities. Because it's essentially our job to get the phone to ring.
Yeah.
But putting it nicely, it's your job to answer your phone.
Correctly.
Right, correctly. Well, and no, let's start with just answer the phone.
Just answer the phone.
Just answer the phone, please, okay? So you might be surprised when I say that 19% of all the calls that we generate with all the impressions that we generate never get answered.
Yeah. What a
19%.
What a waste.
Okay, you could.
Well, we were talking with Jane the other day. She said one of her clients, 80%.
80. Well, that's
of the calls went to voicemail.
Right. That person.
What a criminal waste
right,
that is.
That person helped make the 19 and 19. Okay. If you go through all the clients, all the tracking, the great clients that never miss a call, all the way up to that person. Okay. The average is 19%. So dentists come to us all the time and say, well, I want to increase my marketing impact by my marketing results by 20%. Okay. Our answer is answer the phone. Okay. You don't have to you don't have to spend any more money on marketing. Just answer the phone when the phone rings. Okay. So the first step in call tracking and call management is tracking every phone call that comes in. Okay. And then now, and making sure you answer the calls, making sure that you're answering the phone within a certain period of time when it rings. That may seem like we're being picky, but it's not. You call any store, any service provider you want. If you're on that phone before it's picked up, before that fourth ring, you're wondering what's going on at the other end of that phone. So anyway, so we go through all that stuff. And once that's taken care of, now we go to the human side. Now a human answers the phone. Now there's two humans on the phone, the person that we promoted to who got dialed the 7 numbers to call into the dental office and the person in the dental office that says hello. How is that interaction going? Is that person sounding a little stale? Does she sound bored? Is she eating her lunch? Is she chewing gum? Okay. Or is she incredibly wonderful and sounds like she works at Bellagio?
Yeah.
Right? Okay, so it runs the gamut. You could have just an incredible person who primarily answers your phone, or honestly, you could have someone who needs some work and needs some help, or motivation, or customized and personalized scripting just for them to give them that boost and keep it consistent. Right?
That person is actually, I mean, this is my own personal opinion, but I think I'm right. That person's the most important person in the practice. Now you can say, well, what about the dentist? No dentistry is going to get done without the dentist. Nobody's teeth are going to get cleaned without a hygienist, and that's all true. Yeah. But here's the bottom line. Nothing of a revenue consequence ever happens in a dental practice until and unless the phone rings, and that phone call is treated like the gold that it represents.
Right. So call management means working with the dentist, working with the entire staff, whoever's going to answer the phone, okay? Creating, after the analysis of the call volume and if their calls are being answered, making sure call coverage and, lunch times and on Fridays when most of you don't work, okay? Once that's all settled and we get to the human side, then the call management is working with the dentist, working with the whole team, making sure there's a balance between what your office staff is saying to the patient and maximizing the number of inquiries into new patients in your appointment book, okay? Because you can't say, yes, we do everything, yes, we take every insurance plan, yes, we do this, get them in your book, and then have a whole lot of unhappy new patients. Right. That's not going to help you long term, okay? So there has to be that consult and balance that's really customized, to each dental office, because some dental offices come and they need 300 new patients a month or they're going to turn the lights off. And then we have practices who only need 8 or 9 additional new patients and are going to be just fine.
Yeah.
So that all has to be customized and implemented, tracked, and accountable to the staff. And when that's call management.
Yeah.
That, it's certainly something you might want to consider. We look at it as marketing insurance.
Well, yeah.
We don't sell insurance, okay? But if you put out however many thousands of dollars in dental marketing and you don't know who's calling, how many people called, if your staff's answering the phone, how long it's taking them to answer the phone, if they're answering it right, if they're not, how often they are, how consistent they are, how many of those inquiries actually became new patients, what the source of those if you don't know that, then
You're going to think your marketing isn't working.
You're going to really think your marketing isn't working. Okay, so it's almost like marketing insurance. All right,
Yes.
we strongly recommend it for a first-year client.
Absolutely.
Okay, and anytime the staff turns over,
Yes.
your receptionist may move to Oregon, and you may have to replace her, and we get a refresher. Get it all customized just for her, and get her educated, and then. You shouldn't skip a beat with your marketing results.